I've talked about different procedures you can do in office and at home, but so far never touched on microneedling. One of the reasons for that was that I never had it done professionally and am not a big fan of microneedling at home for reasons I will talk about later on. But first, let's talk about what microneedling actually is, what it can be used for, and if there's data behind it. Have you had it done professionally or do you microneedle at home? Let me know in the comments below. If you're new, you're welcome. I'm Dr. Anne, a physician passionate about skincare and well aging. Microneedling basically means you take tiny needles and poke holes in the skin, ideally penetrating the stratum corneum. This physical trauma induces a wound healing cascade with recruitment of platelets and neutrophils that release growth factors like TGF-alpha, TGF-beta, and platelet-derived growth factor, which in the end result in stimulation of the fibroblasts to produce new collagen. This mechanism is similar to things like radiofrequency or ultrasound that also set a trauma by heating up the tissue to stimulate collagen production, but the trauma is a different one. To achieve the best effect here, you should reach the stratum papillare, which is right where the epidermis meets the dermis, so the needles should be long enough to penetrate the whole epidermis, which is, depending on the area of your body, between 0.03 mm around the eyes and up to 4 mm on the soles of your feet. On average, it is around 0.5 mm though. The small channels created by the needle stay open for around 24 hours, so products applied immediately before, during or shortly after the microneedling process can get deeper into the skin as they don't need to penetrate the epidermis. That effect is strongest for skincare used directly with microneedling and fades over time. Microneedling can be used to treat a variety of skin conditions. The first use was for atrophic or indented acne scars as early as 1995, but since 2006, when the prototype of the popular derma roller was invented, it has been used for a multitude of skin things like pore tightening, wrinkles, skin laxity, stretch marks, and various forms of pigmentation issues on the skin, as well as for the treatment of alopecia or hair loss. Microneedling for different skin conditions has been studied, but the amount and quality of data we have differs depending on the condition. For the treatment of atrophic scars, both from acne or other reasons, there are several that show the efficacy with histological samples that show a statistically significant increase in both collagen quantity and quality, and that effect has also been demonstrated in different ethnicities and in comparison to other treatments like in-office peels or laser. For both, the effects were comparable, but downtime and side effects for microneedling lower. As the increase in collagen quantity and quality is what we are looking for in the treatment of wrinkles, skin laxity, stretch marks, and pore size, it seems safe to transfer these results to those skin conditions as well, despite having less data looking for these endpoints. For the pigmentation disorders, we have to differentiate between hyperpigmentation like sunspots, pigmented acne scars and melasma, and depigmentation like vitiligo. For hyperpigmentation, studies are there, but of varying quality and most often combine the use of microneedling with skincare like tranexamic acid, TCA peels, or hydroquinone used alongside the needling, which doesn't tell us if microneedling alone would have a similar effect. For only microneedling combined with sunscreen, there is much less data, but the data we have seems promising. For depigmentation, on the other hand, it is too early to say and more studies are needed to determine if it is beneficial. Quickly touching on hair loss, or more specifically androgenetic alopecia, here microneedling has shown to improve the results of topical minoxidil and/or oral finasteride compared to topical or oral treatment alone, and even rendered results in people unresponsive to topical treatment before. For all studies done, you have to note though that both the frequency as well as the needle length had great variation, so we can't yet say which protocol or needle length is the most effective. When looking at the tools available for microneedling, you can divide them roughly in rollers and in stamping devices. Rollers are rolled over the furs vertically, diagonally, and horizontally. The stamping devices are either automatic, like the DermaPen, which also allows you to adjust the needle length based on area of the face you are treating, or are stamped into the skin manually, one area at a time. Some of these devices come with additional things like radiofrequency admitted through the needles, but those are usually only used in office. While you might expect that there would be a difference in needle length between devices used by professionals and the ones for at-home use, that isn't always the case. You can easily buy rollers or pens with up to 2 mm needle length off of Amazon, and at least the rollers are quite cheap no matter the length. The deeper you go, the higher the risk for injuries to skin structures like nerve endings or bigger blood vessels. Different is the way you can take care of your device though. No matter how thorough you are at home, you're only able to cleanse and disinfect the device. It will never be sterile, as that needs a specified process involving equipment you don't have at home. Medical devices meant to puncture the skin, like needles for taking blood, need to be sterile. Devices that don't puncture the skin, like a blood pressure cuff, will be disinfected between uses. That is a difference you need to be aware of. The only way you can get sterile equipment at home is by using a new head or roller every time you microneedle. The last and probably biggest difference between in-office and at home is that if you do the procedure in office, you hopefully have someone that knows what they are doing and can judge the right products to use alongside the treatment, the right depth and intensity, while at home you have to rely on what you taught yourself. While microneedling is usually safe, a few things can happen. The most common are transient redness through the increase in blood flow, as well as pinpoint bleeding that always occurs. Major bleeding, on the other hand, is very rare even if you are on blood thinners. Depending on the needle depth, you could injure skin structures like nerve endings, or when used around the eye where the skin is thin, even the bone or the eyeball. Whenever you puncture the skin, be it accidentally or on purpose, you have a risk for infection. So when you puncture hundreds of holes in your face, that risk increases. Dirty skin or contaminated equipment needs to be avoided to keep the risk for infection as low as possible. There's also a risk for post-inflammatory hyperpigmentation, as well as a risk for keloid scarring, those prone to that, which increases if the needling isn't done properly. It not being done properly is actually the biggest risk I see, especially with rollers of low quality and blunt needles. To create minimal trauma and side effects, you should puncture the skin as straight as possible. So if you don't know what you're doing, or your roller head is loose, or the needles are blunt, chances are you are not creating a vertical puncture, but you are dragging the skin, which leads to micro tears and the skin surface. There are a few videos on TikTok where people demonstrate that with a banana, and the difference between the roller and stamping devices in the way the skin is bruised is huge. Other rare side effects would be so-called tram track scarring, where the pinpoint bleeding doesn't go away, but a lasting redness where the roller vent stays, looking like a tram track, and granulomas forming beneath the skin surface. Granulomas are small, hard nodes that develop when particles are brought beneath the skin barrier that don't belong there and trigger an inflammation, which, in the process, encloses the particle. This could be either small dirt particles or skincare you needled into the skin that wasn't supposed to go there. Microneedling increases the absorption of your skincare because it allows it to bypass the skin barrier through the tiny holes. Traditionally, microneedling was done with NaCl, a saline infusion, to make it easier for the rollers to glide over the skin. The addition of things like hydrating or skin brightening ingredients came later. If you decide you want to use skincare with your needling device, make sure it is specifically designed and tested for that purpose. Skincare is formulated for topical application. You don't know how products formulated to be applied on the epidermis will react when the epidermis is bypassed. They come in contact with different cells from the immune system down there, for example, which could sensitize you for different ingredients. It could lead to much higher concentrations and subsequently irritation, and in some cases even to granulomas, small hard nodes underneath the skin as part of the body's defense against intruding particles. Microneedling is affordable, works on a lot of skin conditions and different ethnicities, and is considered safe when done properly. The when done properly part is what worries me though, as there are many things you can do wrong when you do it at home. It starts with the quality of the needles, as cheap ones will get blunt quickly, the risk for infection as you need to change the head with each use if you want to make sure it isn't just clean but sterile, and goes on with the desire to experiment and do a little more than recommended when we are left to our own. Obviously, we know our skin very well, but I am sure there's someone out there with a video microneedling tretinoin into their face, and if it's out there, someone else will surely follow their lead. If you decide to microneedle at home, I suggest you use a stamping device rather than a roller, change the head with each use, and not use products that aren't specifically designed to be used with exactly your device. Oh, and limit the needle length so you don't actually puncture your eyeball. For optimal results, you should get 6 to 8 sessions that are spaced 3 to 4 weeks apart. The collagen induction needs time and repair, so needling your face every day will not increase the speed, nor will you be able to judge the effect after one treatment. The downtime after microneedling depends on the area treated and your individual reaction to trauma. Pinpoint bleeding, so red dots on the skin, are visible for at least 24 hours, and you should avoid using makeup or skincare not designed for microneedling for 3 to 7 days afterwards, depending on the irritation potential. The risk for post-inflammatory hyperpigmentation increases with UV exposure, so ideally you don't do it right before a beach holiday and wear sunscreen or use other means of sun protection afterwards. As far as how long the results last, it is the same as with other devices. The collagen induction is permanent, but the new collagen will degrade just like any other with time, so firmness will increase and then decrease again with the natural aging process. Atrophic scars and stretch marks, however, will not reappear over time, so here the results are permanent. For hyperpigmentation, you will obviously have to continue to avoid UV exposure so it won't reappear. Microneedling is affordable, works on a lot of skin conditions and different ethnicities, and is considered safe when done properly. It works by poking small channels into the skin that go deeper than the epidermis, which induces a wound healing response triggering formation of new collagen. That can help with skin laxity, wrinkles, and atrophic scars, either from acne or stretch marks. The channels also allow products used simultaneously to penetrate the skin deeper by bypassing the first protective layer. While considered safe when done by a professional, at-home use has a higher risk for side effects like infection and scarring. To see best results, you need 6 to 8 treatments spaced 3 to 4 weeks apart, but your ideal treatment plan should be discussed with your treating professional. If there is anything you would like to add, please do so in the comment below. I will link to more videos you might find interesting on the screen and add links to my Instagram blog and Patreon account in the description box. See you soon. Bye!